So good morning everybody. We'll start today organ function test. Out of this, today we'll discuss kidney function test and gastric function test. As you know, kidney is an important and vital organ for the body, and all the metabolites, all the excretory products produced in the body following metabolism is excreted through kidney. So without proper functioning of the kidney, we cannot sustain life. Main function of kidney, as you know, maintenance of homeostasis, water, electrolyte and acid-base balance. Excretion of metabolic products, protein and nucleic acid metabolism like urea, uric acid, creatinine, sulfate, phosphate, etc. Retention of substances vital for body like glucose, amino acid, etc. from the urine. Then it has hormonal function, secretion of erythropoietin, calcitriol, renin. These are the hormones secreted by the kidney. Erythropoietin is required for erythropoiesis, RBC, development and maturation. Then calcitriol, as you know, for calcium metabolism, active form of vitamin D. Then renin is required for synthesis of angiotensin II production, and angiotensin II is required for action of the aldosterone, thereby regulating the water and mineral metabolism. Now let's have a look regarding formation of urine. The kidneys, its functional unit is nephron. Nephron is the functional unit of kidney. Each kidney contains about 10 lakhs of nephron, that means 1 million of nephron for each kidney. Here is a diagram of nephron. Nephron has main 4 parts. This is the glomerulus. This is the proximal convoluted tube, loop of Henle, distal convoluted tube, and collecting tubules. Blood supply of kidney, about 1200 ml of blood, whole blood, or 650 ml of plasma is supplied in kidney per minute. This accounts about 1700 liter of blood per day. Out of this 1200 ml, about 120 to 125 ml is filtered per minute, which is called glomerular filtrate. More than 99% of the glomerular filtrate is reabsorbed and rest is excreted as urine. Per day, 1.5 liter of urine is excreted from our body. The glomerular filtrate contains similar components of that of plasma, except proteins having molecular weight more than 69,000 Dalton. So its composition is almost like a plasma. But as it passes through the different part of the nephron, many of the substances are reabsorbed from the glomerular filtrate, and lastly, major quantity of glomerular filtrate is absorbed and remain only 1.5 liters as urine. Composition of urine and glomerular filtrate is quite different, as maximum of the substances required for the body are reabsorbed from the tubules. Glomerular filtration, all unbound constituents above 69,000 Dalton of plasma filtered out. It has similar composition to plasma. Most of the soluble constituents are reabsorbed by the active or passive processes. Excreted urine composition is entirely different from filtrate from which it is derived. Renal threshold of substances. This is the some substances, and their reabsorption depends on the concentration in the blood. These are called renal threshold substances. When the substances are within the renal threshold level, they are completely reabsorbed from the tubule. Like glucose. Glucose, its renal threshold is 180 milligram per deciliter. When it is within that range, the glucose is completely reabsorbed. So its definition is renal threshold of a substance is defined as its concentration in blood or plasma beyond which it is excreted in the urine. So when blood sugar level or blood glucose levels goes beyond 180 milligram, it starts filtering out and excreted in the urine. Like calcium, 10 milligram per deciliter, ketone bodies 3 milligram per deciliter. These are the renal threshold of these substances. During calculation of renal threshold, both the kidneys should be normal. If there is one normally functioning kidney, human being can sustain his life. But if there is one non-functioning kidney and one is functioning kidney, the blood, it gets divided into both the kidney. The functioning one is excreting the metabolic waste, but the non-functioning is not. So the activity of removing the excretory products becomes half. Okay? But if this non-functioning kidney is removed, then the single kidney is able to perform the 100% activity. For some of the substances, the tubule has a maximum capacity of reabsorbing those substances. Okay? This is called tubular maximum. It is defined as maximum capacity of the kidney to absorb a particular substance per minute. tubular maximum for glucose is 350 milligram per minute. In tubular disease, renal tubular disease, this tubular maximum, it goes down so that the glucose which is supposed to be absorbed from the renal tubule will be excreted in the urine. Now to test, these are the tests to assess renal function. Now it is because of, for early detection of kidney damage, renal test to assess the renal function for early detection of kidney damage. There are several tests required because it has different parts and different parts of the nephron have different function. So only one test cannot determine the function of the kidney. To show abnormality, at least 2/3 of the kidney function has to be damaged. The test can be divided into 4 groups. Glomerular function test, this can be determined by inulin clearance test, creatinine clearance test, urea clearance test. Clearance tests are meant for determining the glomerular function test. Tubular function test can be checked by concentration and dilution test. Other than this, we can analyze blood to see urea level, creatinine level, protein level and electrolyte levels. Then simple routine examination of urine also can give a good idea about the renal status, functioning of the renal functioning status. Glomerular function test, measuring of GFR by clearance test is most useful test. Clearance is defined as, in general, it is defined as the volume of blood or plasma that would be completely cleared of a substance in 1 minute. Or clearance of substance refers to the milliliter of plasma which contains the amount of substance excreted by the kidney per minute. In 1 minute, the amount of substance which has been excreted, this much amount which is present in the blood is the clearance of that substance. So first one is easier. Clearance in general is defined as the volume of blood or plasma that would be completely cleared of a substance in 1 minute. Clearance is expressed as ml per minute, calculated by the formula C is equal to U into B by P. C is clearance, U is urinary concentration of that substance in milligram per deciliter. Volume, B is the volume of urine passed in 1 minute. Volume of urine excreted in 1 minute. P is plasma concentration of that substance in milligram per deciliter. Remember, the substance of interest should be expressed in same unit, either in milligram per deciliter or millimole per liter. Both should be in same unit. Now, how to determine the volume of urine excreted in per minute? In such situation, the patient is allowed to collect urine in a bottle for 24 hours. In the morning, he is asked to void the urine. Then, whatever urine, whenever he passes urine, he has to pass in a container and collect it till the next morning. Hello, what happened? Kya hua? No, if you are not interested, you can go out. No, don't disturb. Why you are disturbing? So, after collecting 24 hours of urine, it is divided 24 into 60. So, per minute, your urine is expressed, and that is used here. Nowadays, it is very difficult to collect urine for 24 hours. The patient has to carry a bottle along with him, and whenever he wants to go to a bathroom, he has to take it and he has to collect the urine. So, to overcome this problem, a thing is this process is a bit modified. They have modified it into collection of urine after giving water. Collection of urine is done for 1 hour only. Okay, and that is divided by divided by 60. So the per minute urine output it is calculated. Now, first clearance test is inulin clearance test. Inulin is a plant carbohydrate polymer of D-fructose. It is completely filtered out from the plasma. It is not reabsorbed nor secreted from the tubule, and it doesn't take part in body metabolism. So, this substance, inulin, is suitable for determining the GFR. Disadvantage is this is an exogenous substance and need IV administration. Whatever you administer intravenously, that may cause some adverse reaction. That's why this test is not preferred nowadays. Sorry. In practice, measurement of clearance for substances already present in the blood is preferred, like creatinine, urea. These are already present in the blood, so there is no possibility of reaction and adverse effect. Creatinine is creatine from the it is derived from the creatine phosphate of the muscle. Its excretion is constant, not influenced by body metabolism or dietary factor, only marginally secreted by the tubules. So it's using creatinine if we determine glomerular clearance function, then it is almost near to the glomerular filtration rate. The formula is used as before. Clearance of creatinine is equal to urinary concentration of creatinine into volume of urine passed in 1 minute divided by plasma creatinine level. Okay, expressed in milligram per deciliter, both urinary creatinine and plasma creatinine. Normal value of creatinine clearance is 45 ml per minute. Normal value of GFR is 120 to 125 ml per minute. So it is close to the normal value. That's why frequently creatinine clearance test is utilized for renal function test. Diagnostic importance is reduction of 70% or less of the normal value. That means if it is, say for example, normal value is 100, so it should be reduced at 75 ml to indicate decrease in GFR due to renal disease. This is a sensitive indicator used for early detection of renal damage before clinical manifestation. To become clinically manifested, the kidney function should come down to 50%, so that there will be increase in serum, creatinine or urea level. So this is a graph in relation to GFR and serum creatinine. This is the GFR and this is serum creatinine. See, in 120 ml per minute, that is normal. When GFR is normal, the creatinine level becomes less than 0, less than 1 within normal level. But when it is reduced to 75, it starts increasing. It is more than 1. Normal value of creatinine is 1.2, some books it writes 1.4. Now when it comes to 50%, see, when it comes to 50%, it nearing about 2, say 1.8 or something like that. Okay, that means the kidney function has gone down and the serum level of creatinine has raised above normal. Next is urea clearance test. It is also present normally in the blood. Concentration of urea is hampered by, influenced by intake of protein, intake of water, then it is again reabsorbed from the tubule partially. So, though it is not a choice of method for determining clearance test, kidney function test, but still it is used by some laboratories for assessing renal function. It is not so sensitive like that of creatinine. This urea clearance is proper when urine output is more than 2 ml per minute. Maximum urea clearance is applicable when urine output is 2 ml per minute or more. But when it goes below 2 ml per minute, then the standard clearance test is calculated. In this case, the volume of urine, here square root of volume of urine is used. Okay. Of urea clearance is 75 ml per minute. Normal volume of urea clearance is 75 ml per minute. So it is not nearer to the normal GFR level, but still it is used. It is less because its amount is reabsorbed from the tubule. Now, out of this 75 ml per minute, if it gets below at 75% of normal, it is viewed seriously, and when it is 50% of the normal, then the clinical symptoms appear. Tubular function test. It is done by urine concentration test or urine dilution test. Urine concentration test requires accurate measurement of specific gravity. Okay? Normal specific gravity is 1.020 in the morning sample. Measure employed to concentrate urine by water deprivation overnight or by ADS administration, followed by measurement of specific gravity. Any one sample, if specific gravity is 1.020, indicates normal tubular function. In renal disease, chronic renal disease, fixed specific gravity of the urine we observe. That means whether you give water or whether you deprive from water, the specific gravity doesn't change. It is 1.010 fixed in chronic renal failure. This is called isostenuria. Isostenuria. Osmolality and specific gravity has a relation. Urine osmolality of urine is 500 to 1200 milliosmol per kg. Plasma osmolality is 300 milliosmol per kg. So normal ratio is 2:4. Urine and plasma osmolality ratio is 2:4. It is found that urine is with osmolality 800 milliosmol per kg has a specific gravity of 1.020. So osmolality has a role in determining the kidney function. Helps to assess tubular function. Now, how dilution test is done? After overnight fasting, asked to empty the bladder. Our patient is asked to empty the bladder in the morning, and 1,200 ml of water is given to drink over 30 minutes. After that, the urine is collected every hour for 4 hours, and its specific gravity is determined. In normal, 1000 ml or more amount of water is excreted in 4 hours. Maximum is in first 2 hours. The specific gravity will be 1.003 or less. That means it is diluted. Normal is 1.020. So it has come down to 1.003. In decreased tubular function, excretion is less than 1000 ml and specific gravity may be high as 1010. Okay, 1.10 or more. Blood analysis, estimation of urea, creatinine, electrolyte is often used to assess the overall kidney function, that you know. Recently, a molecule called Cystatin C is used to determine the kidney function. This is the biomarker for kidney function. Cystatin C is a low molecular peptide having 13,300 kilodalton molecular weight, secreted by all nucleated cell and excreted by the kidney. Normal serum concentration is 0.8 to 1.2 milligram per deciliter. If kidney function decreases, then cystatin C in plasma increases. Sensitive even in minor change of GFR. More precise, this molecule is more precise and better indicator of kidney function than creatinine. So nowadays, this test is utilized for kidney function status, to see the status of kidney function. Urine routine examination. If there is protein, in case of renal diseases, the permeability of glomerulus increases, so the protein it leaks out through the Bowman's capsule. In that case, we will find albumin in the urine is present. So proteinuria, it also denotes early renal damage. In case of diabetic nephropathy, we estimate microalbuminuria. So if it is positive microalbuminuria, we take it as early diabetic nephropathy. Next is gastric function test. Function of stomach is, it is the reservoir of ingested food, promotes digestion by churning, elaborates hydrochloric acid, promotes and proteases, responsible for initiation of digestive process. Product obtained in stomach, amino acid and peptides, they stimulate release of pancreatic juice and bile. Now, this is how the hydrochloric acid is secreted in the stomach. It is from the carbonic acid. This is generated from carbon dioxide and water by carbonic anhydrase. They get split into hydrogen ion and bicarbonate ion. Hydrogen ion is transported to the lumen in exchange of potassium ion. That is, in the lumen there is concentration of hydrogen ion is much more than the cell. So it has to be carried against concentration gradient. For carrying the molecule against concentration gradient, we need a special carrier. This is called potassium dependent ATPase. Potassium sensitive ATPase. This needs energy for transportation as it is against concentration gradient. The energy is provided by the ATP. So hydrogen ion comes out and potassium goes inside the cell. And the bicarbonate ion, which has been generated in the parietal cells, it diffuses into the plasma in the blood in exchange of chloride ion. Now this chloride ion, this again diffuses out in the gastric in the stomach and combines with hydrogen ion to form hydrochloric acid. Elevation of plasma bicarbonate concentration linked with hydrochloric acid. Bicarbonate, there is a temporary increase of bicarbonate concentration in the blood and that is excreted through urine. So after meal there is a slight increase in alkalinity of the urine, that is called alkaline tide. Now these are the tests to assess gastric function test: fractional test meal, alcohol test meal, pentagastric stimulation test, augmented histamine test meal, insulin test meal, tubeless gastric analysis. In fractional test meal, it is old method. Nowadays it is not used. Stomach content is aspirated out in the morning using Rayleigh tube. Rayleigh tube, that is a thin tube passed through the nose up to the stomach and content is aspirated out. Then after that, gastric secretion is stimulated by giving test meal. Test meal in the form of rice gruel, black coffee, like that. The meal is given. After the meal, the stomach gets activated to secrete hydrochloric acid. Then stomach content is aspirated at 15 minutes interval for 2 hours. After that, after aspiration, give the meal. After giving the meal, every 15 minutes, withdraw the gastric secretion and analyze for free acid and total acid. It is normally represented by graph. Alcohol test meal, here meal is used as alcohol. 100 ml alcohol, 7% alcohol is given. Advantage of this test is response is very rapid and time taken for the test is very short. The sample which we get after aspiration is clear. So estimation is very easy. But here free acidity is a bit higher than the fractional test meal. Next is pentragestin stimulation test. Here pentragestin is synthetic peptide which stimulates gastric secretion like gastrin. After aspiration of stomach content, the first stomach content before stimulation which is aspirated is called residual juice. Then gastric juice is elaborated for next 1 hour. First aspiration is done, then 1 hour we have to wait. We have to see how much gastric juice is secreted in 1 hour without stimulation. So that is again collected. This is called basal secretion. First is residual secretion, then basal secretion. Now pentragestin is given 5 microgram. This is microgram per kg to stimulate gastric acid secretion. Then gastric juice collected every 15 minutes for 1 hour. This period is maximum secretion. Now these samples are titrated against 1/10 sodium hydroxide to find acidity. Basal acid output is output in millimole per hour in the basal condition before stimulating. This is usually 4 to 10 millimole per hour. Maximum output, it is 20 to 50 millimole per hour. Augmented histamine test. Here histamine is used for gastric secretion stimulation. Insulin test meal. Here insulin is given as stimulator. This test is usually done after vagotomy operation. Vagotomy operation means previously when there was hyperacidity and peptic ulcer, they used to do a type of operation. The vagus nerve which is supplying the stomach is cut. So acid secretion becomes very less, okay, or stop. So to see the completeness of vagotomy, they used to use insulin test. After giving the insulin, they estimate the juice. If it is not increasing, then vagotomy is successful. Only drawback of this test is that it can produce hypoglycemia. So it has to be done in cautiously. Tube-leg gastric analysis. Putting a rice tube inside, keeping the tube for so many hours, 2-3 hours. Again, repeatedly aspirating through this tube, it is very discomforting for the patient. So this tubeless gastric analysis has come up. Here rice tube is not used. Principle of the test is a cation exchange resin is administered in the stomach. It binds with the hydrogen ion and get absorbed in the blood, excreted in the urine. So that resin is again extracted from the urine and estimated. That gives the amount of hydrogen ion secreted in the gastric juice. Administration of cation exchange resin that gets quantitatively exchanged with hydrogen ion of the gastric juice. Resin then excreted in the urine, which can be estimated for indirect measurement of the gastric acidity. Quantity of indicator cation is directly proportional to the amount of hydrochloric acid produced in the stomach. Cation exchanger like quininium resin or Diagnex blue. It contains azure A resin, is employed in the tubular analysis, gastric analysis. Abnormalities, there is an increased gastric secretion in Zollinger-Ellison syndrome. This is gastrin secreting tumor of the pancreas. A huge amount of acid is secreted. The patient often has peptic ulcer in this case. Then chronic duodenal ulcer, gastric cell hyperplasia. In these cases, there is increased secretion of acid, hydrochloric acid in the gastric juice. Decreased secretion like chronic gastritis, gastric carcinoma, then pernicious anemia, it is reduced. So these are the organ function tests. For you, it is important. Important organ function is a kidney function test, because when you proceed for the clinical postings, that these kidney function tests you often find. So this is very important, and you may get question also. Gastric function test nowadays not frequently done. Okay, that finishes organ function test. Thank you.